Hello, everyone. Welcome to Decentralized Health Administration at the Ubrica Project. My name is Dr. Macharia Waruingi, and I bring to you every day critical technical knowledge about creating perfect conditions for much needed revolution in the health industry. In the health industry, we need revolution. Under these new conditions, universal health access will be possible, or what you call universal health care. And everyone in the world, including you and your loved ones, will have access to the best health services available. Health for everyone will be of highest quality in the world, and it will be affordable by all. I come to you each and every day from the Ubrica project, located at 1.4 degrees south of equator and 37 degrees east of the central meridian. That puts us in the southwestern suburbs of Nairobi. We are not far from a very beautiful place, a national park to the back, the elephant orphanage in front. In the front side, we have about a half a kilometer, let's say about 5 kilometers, the giraffe center, and of course we have the ostrich farm, and then to what is it? To the further west, we have the Olorua National Park. Well, let's say Olorua Conservancy, something like that, where you find quite a number of wild animals. And so we are surrounded by nature and wild animals, and that is really good. So today, I would like us to speak about artificial intelligence in decentralized health. And this is accepted again, as we spoke before, from Decentralized Health Administration textbook under development by Susan Nyambura Njuguna here in Ubrica Research and Development Team. But first, the basics. We said, what is the job of the Ubrica project? We have Ubrica project strives to solve three fundamental problems of health production in the world. Problem number one, lack of access to health services. Access is a problem. Number two, poor quality of medical services. Quality is a problem. Number three, high cost of medical services in the world. That's cost of medical services is a problem. We solve the problem of access due to lack of money by creating sokojanja.com, an online retail store where anyone in the world can sell what he or she has produced to increase the earning power. Because having money in the pocket means realized access to health. We solve the problem of physical access through Ubrica clinics and hospitals project. And then the quality problem is solved by Ubrica Science and Technology Parks, because science and technology parks create places for translation and commercialization of new and relevant knowledge, ensuring best quality of medical services. Yeah, or medical knowledge. Ubricoin Biomedical Industrial City promotes local manufacturing of biomedical products, reducing cost of medicines and medical devices and health services in general, making healthcare affordable. So Ubricoin, the cryptocurrency for universal health access, underwrites health production in the Ubrica ecosystem. You ask, where is the money going to come from? Ubricoin is money, and it is a cryptocurrency for doing that job. You can support universal health access by getting and adding Ubricoin to your portfolio of cryptos, or by getting equity in the Ubrica project. So get involved. Do not sit on the sidelines of health. Buy and hold at least $10 worth of Ubricoin each and every day. $10 worth of UBN. Soon you will have hundreds of thousands of UBN, and of course, you will be supporting universal health access. You can get even more involved by joining the World Ubricoin Ambassador Program, the WUAP, where you can gain deeper knowledge about the Ubrica project and continually share that knowledge with people in your circle of influence. As an ambassador, you'll be the bridge between Ubricoin, Ubrica, Sokojanja, and people in the world. Now, to show continued support, hit the like button to cement your support, then hit the bell button so that you can subscribe or receive notifications from the Ubrica project, and participate in the chat, ask questions, ask anything about health and how we can decentralize health to the world, and share your views on how we can decentralize knowledge in health and medicine at the YouTube channel. Then let's dive deep into today's topic. Today, I would like to talk about artificial intelligence. Artificial intelligence in decentralized health. What is artificial intelligence? Is about knowledge that computer can have that can match human knowledge. Of course, that sounds scary, but that is what it is. And so we know that computers can perform tasks that human beings could perform, and that is this helping human beings, like expanding the human brain. Well, there's been a lot of work in this area. And so, what about artificial intelligence? Is a field that has been developing for many decades, but now we are talking about artificial intelligence or decentralized artificial intelligence on blockchain. Blockchain projects like the Ubrica will help gather intelligent data about health, nutrition, information, and diseases. With an increase in the volume of patient or let's say health data available from various electronic and mobile devices, as well as unstructured data such as photos, physician notes, sensor data, and genomic information, it's becoming increasingly difficult to organize these incoming data streams coherently using traditional computational algorithms. So, with technology supporting artificial intelligence, we can now easily capture, catalog, review, analyze, and then act upon data in an efficient manner. Artificial intelligence will facilitate the presence of global health. Data gathered will help us to develop smart community health decision support system, smart public health decision support system, and smart clinical decision support system. So I want us to focus on those three support systems again. We're talking about smart community health decision support system. That means gathering data at the community level, which would help us make intelligent decisions about preventive medicine or prevention of diseases before they occur. And at the community level, even at the family level, by working on that, we could prevent occurrence or emergence of epidemics. And we're talking about also smart public health decision support system. Smart public health decision support system can now help us to detect diseases before they affect the public to cause epidemics. And then we can stop the epidemics on their track. Boom. And then, of course, smart clinical decision support system. That is, if the disease has affected the person is already sick, then the person goes to the hospital, then the clinical decision support system helps the clinicians to make faster decisions. Now you can see a smart clinical decision support system working very, very well, particularly in remote condition where the diagnostic capability is weak, where the clinicians do not have all those gadgets to make diagnosis, and then the the clinician is left without much to do. But now with smart clinical decision support system, the clinician has got help. And of course, that is one way to distribute knowledge in medicine all the way down. Of course, with smartphones such as this one, we can distribute all the smart community health decision support system, and we shall. I'm not saying we can, just we can, we shall distribute the smart community health, the decision support system, so that every community health worker has got a device such as this one, being a smartphone, and then is going about visiting families and is detecting diseases just from asking questions to the people within the family. Like the lady asking her, the lady of the house asking her, how are children? How are they? Then she can enter symptoms like fever, high temperature. She can enter symptoms like headache, and so on and so forth, bleeding from the nose, and that's possible even to using a smart decision support system algorithm. You can detect a hemorrhagic fever by interviewing people in one family, and then of course such a report can be sent to the infectious diseases labs, and then someone comes in to evaluate whether that decision was correct. So you can see using such devices, we are able to reach people down to the remotest level. Now, in Kenya, for example, the penetration for the phone is more than 90%. You can say there are two telephones in every family, and that is very high penetration. It means that literally we have 100% telephone coverage. Although not all of them are smartphones, in a few years, particularly with application of cryptocurrencies and the blockchain technology, with money being available, we shall be able to have smartphones distributed in literally every household in the nation. And of course, most likely a smartphone in every household in the entire African continent, except maybe in those countries where there is dictatorship and censorship. But we hope that doesn't happen, so that we can have every household having at least one smartphone. And I think even working with telephone companies, and cryptocurrencies, that means money available such as UB, and we are able to distribute telephones to everyone so that we can have smart communities, we can have smart publics, we can have smart clinicians. And these smart clinicians are the result of working with smartphones. Now, we know that some of the applications of artificial intelligence in healthcare will include disease detection, disease surveillance, and disease monitoring. Let us look at disease detection. We have witnessed a huge surge of development of new detection systems designed to provide more timely detection of outbreaks of diseases. The new detection systems are designed to reduce time delays in reporting and to detect outbreaks when affected individuals first are experiencing early stages of illness. These systems employ different strategies, including use of electronic data transfer, use of routinely collected data for other purposes, and novel approaches to passive collection of data and novel approaches to active collection of data. Applications and plug-in accessories are turning the basic smartphone into a single device that one day could perform basic lab tests and reliably diagnose health problems ranging from simple infections to cancer. Some attachments act like EKG machines to let your phone monitor your heart's activity, cholesterol levels, and glucose monitoring. At the University of Washington, that's Washington in Seattle, researchers created an application to screen pancreatic cancer. It works with light blocking phone to acts with a light blocking phone enclosure that lets you take a perfectly exposed selfie, like this. That the app's algorithm checks the whites of your eyes to check for subtle signs of jaundice, and then suggests treatment options based on your preferences. This application allows doctors to identify cancer early and provide personalized treatment plans. Now, receives database of diseases. In response, it will recommend an appropriate course of action based on a combination of reported symptoms. Can you believe it? So it will with the combination of the symptoms that you've reported, your patient history, and then patient circumstances. Then at Stanford University, researchers have trained an algorithm to diagnose skin cancer using deep learning, specifically deep convolutional neural networks, CNN. Now, the algorithm was trained to detect skin cancer or melanoma using 130,000 images of skin lesions representing over 2,000 different diseases. You can see there is huge potential for artificial intelligence. Now, if you come to remote places like where we are in Kenya and where there is no doctor, in such many kilometers, and of course, where the doctors are very few, artificial intelligence is going to be very, very, very helpful. And of course, with cryptocurrencies, now we are able to channel money into creating these technologies. What about disease surveillance? Disease surveillance, making when some now we are talking about disease detection. Let's go to disease surveillance. Now the disease has already occurred. We can use AI to capture information about from indicators like country reports, monitoring reports, social media, medication purposes, hospital and emergency department data for real-time surveillance that can expedite detection of outbreaks of potential public health concern. Examples of artificial intelligence used in disease surveillance include Public Health Agency of Canada Global Public Health Intelligence Network, which they call GPHIN, which is a digital automated surveillance tool which collects information from news feeds aggregators and then reports to national and international agencies such as the World Health Organization's Global Outbreak Alert and Response System. So it's already happening. Now, this type of work then needs to be decentralized instead of just having happening in Canada, in the Canada Global Public Health Information Network. It should be decentralized so that this is available. And of course, sure enough, with cryptocurrencies, with providing resources, and with blockchain technology, making it possible that data is stored in a public ledger and distributed ledger, then such work of surveillance will be possible. The current diseases surveillance systems are relying more and more on massive quantities of data from non-traditional sources, ranging from internet search queries and user-generated web content to detailed electronic media records to continuous data streams from sensor networks, cellular telephones, and other location-aware devices. So, diseases, epidemics, you're on your way out, yeah? Where do we get this going? And of course, we're inviting people in the world to participate in this work so that we can stop diseases and epidemics on their tracks. What about disease monitoring? The revolutionary changes in health and healthcare are already beginning to use smart devices to monitor individual health. Many of these developments are taking place outside traditional diagnostic clinical settings. There are many impressive smartphone attachments and applications currently available for monitoring personal health. I use Samsung Health myself. Of course, let's say Samsung Health just starts working and tells me how many steps I've walked. When I go out running, it tells me how many kilometers I've run, tells me even how many calories, my heart rate, temperature, and all of that. Even tells me when I went to sleep, how many hours I slept, when I woke up. It's really good. So smartphone attached, these applications are currently very good. These devices empower individuals to monitor and understand their own health, and they create large corpuscles of knowledge, like large bodies of knowledge and data that in theory can be used for AI applications and capture health data that can be shared with clinicians and researchers. I am saying that we're not just going to use them in theory. We are going to work very hard over the next 2 years to make sure that all this data is analyzable and can be used by clinicians and researchers to promote health. Monitoring patients' infections allows identification of outbreaks and study of infection dynamics. Continual patient monitoring in certain types of patient conditions become necessary to assure timely intervention by healthcare practitioner or physician to initiate the right medical procedure or administer the required medication in a timely manner. Now, it sounds like the utopia of health, but this is not utopia, ladies and gentlemen. It is something that is totally possible and is going to be actionable, but it won't work unless we do it. We have to get together and think about health in a global scale. We think about health in a global scale because we have the technology to help us achieve it. So again, Ubrica project strives to solve these three fundamental problems of health production in the world. That is, lack of access to health services, the poor quality of medical services, and high cost of medical services in most of the world. We said again that we developed Soko Janja, an online retail store where anyone in the world can sell what he or she has produced, increasing the earning power. Money in the pocket means realized access to health. Ubrica clinics and hospitals project ensure physical access to health services, and the Ubrica Science and Technology Parks create places for translation and commercialization of new and relevant knowledge, ensuring best quality of medical services in the world. And Ubrica Biomedical Industrial City promotes local manufacturing of biomedical products, reducing cost of medicines and medical devices, and ultimately health services in general. So, Ubricoin, the cryptocurrency for universal health access and the right health production in the Ubrica health system. We said again that you can support universal health access by adding Ubricoin to your portfolio of cryptos or by getting equity in the Ubrica project. Get involved today. Do not sit on the sidelines of health. Buy and hold at least 10 $10 worth of UBN each and every day, and soon you'll have hundreds of thousands of UBN, and you have supported the greatest effort in the world to produce universal access to health for everyone. You can get even more involved by joining the World Ubricoin Ambassador Program, where you gain deeper knowledge about Ubrica project and continue to share that knowledge with people in your circle of influence. As an ambassador, you'll be able to bridge Ubricoin, Ubrica project itself, and Soko Janja, and the people in the rest of the world. I have to stop there today because we've spoken for quite a bit of time now. Thank you, and we look forward to giving more information. Tomorrow we go much deeper in artificial intelligence and how it works, so that you have an inside scoop. Bye for now. Goodbye. I'll see you.